Now I'd like to talk to you about some of the tests that we use to help diagnose what are the root causes of your inability to lose weight. First of all, when you come into our office, we do a very detailed medical history and detailed physical examination. We also use a series of questionnaires that are targeted to each one of these categories so we can see which area you're having a problem with. Then we do testing, and that means blood testing, saliva testing, stool testing, to look at these various components. I will tell you this, that most of the testing that you have on your annual physical examination when you go to your medical doctor for your yearly exam is not thorough enough. I call it the HMO blood chemistry exam because you have the minimal amount of tests that are ordered, just enough so that your insurance company won't be annoyed with you or annoyed with your doctor, and also the smallest amount of tests because most doctors are only going to order tests if they think that there's a drug solution if the test result is abnormal. We're instead looking at health and promoting health, so consequently we want to look at more tests. Okay, we also want to look at the results in a different way. We have a narrower range that we look. There's a healthy range, and then there's your LabCorp or your Quest range, which is the pathological range. So we look for that more narrow range when we interpret the results. Okay, so let's talk about some testing. So generally speaking, what we do is what's called a comprehensive blood chemistry analysis, and that includes a complete blood count. It includes a chemistry panel, which includes glucose and sodium, potassium, and various other factors. In particular, with glucose, we can do a glucose insulin tolerance test if we think your blood sugar is slightly abnormal. We can test your insulin level, which is an early sign of blood sugar abnormalities, before your glucose level rises, or even before your hemoglobin A1C level rises. We also do a thyroid panel. When we do the thyroid panel, it's not just TSH, which is normally what's done, in T4. We look at the free T4, free T3, and we also look at thyroid antibodies if we suspect you have an autoimmune thyroid. So it's a very thorough thyroid panel because thyroid's a very important gland to look at. We also test your lipids. In other words, HDL, LDL, cholesterol, etc. We might do some advanced testing there to look at the particle size of your LDL molecules, because that's really what's important. How big is the LDL particle? Is it small and likely to get stuck in your blood vessels, or is it large and fluffy and likely to flow through your blood vessels without getting stuck? We might test fibrinogen, which is the ability of your blood vessels to clot, or the ability of your blood to clot. If it's clotting, of course, that's a problem. Okay. In addition, we could do an iron panel if we think that you might be anemic or have low or high iron stores. We could also test for other things like C-reactive protein if we think that you have a tendency towards inflammation. C-reactive protein is a very sensitive test for inflammation, and that's important to do. If we think that you have sensitivity to certain foods like gluten or any other food, we can test for those very specifically. We can use IgG testing to see if you're sensitive to these foods. Because all these, if you are sensitive to gluten, it's going to cause problems with inflammation. It can cause problems with detoxification. It can even affect your thyroid. Okay? In addition, if we think that you're suffering from too much stress, we can do what's called an adrenal stress index. That's a salivary test. Test your saliva. And we'll test your cortisol level. Okay? And see if we can do something about that with the results of the test and bring your stress level down. Your cortisol level should be very high in the morning so you can wake up and get on with your day, but low at night so you can go to sleep. And if it's not, you can have a problem. We can test male and female hormones. Now, usually these are not tested correctly. If you get a blood test for male and female hormones, it's not accurate because they're steroid hormones and they're being carried in the blood by proteins. So you have to have a saliva test to test them accurately if you want to test testosterone or estrogen. Okay. So those are some of the tests that we use. We might also test you for leaky gut syndrome if we feel you have a problem with your barrier between your intestines and your blood. We'll talk about that more in another video. Matter of fact, we have an entire video on leaky gut syndrome. We might test you for GI pathogens and intestinal dysbiosis. Okay, that's good for now. And now in just a second, we're going to move on to the next part, and that's talking about what we can do about all this to help you.